Have you heard about the Smart Healthcare Facilities initiative being implemented by UKAID and PAHO in collaboration with the Ministry of Health and Wellness? If yes, today on Western Roundup we have an update for you. But if not, we highlight the St. Anne's Bay Health Centre along with 8 other centres that have recently benefited from the project. Stick around. 9 health facilities have been handed over to the Ministry of Health and Wellness, having been retrofitted under the Smart Healthcare Facilities in the Caribbean project.
Today marks the culmination of 11 months of work, resulting in the handover of 9 health facilities, which were retrofitted using WHO PAHO's SMART standards at a value of 320 million Jamaican dollars. The St. Anne Bay Health Facility was retrofitted to improve the resistance across a range of hazards, including strong winds, flooding, and earthquakes, and to boost the greening of the facility, and this one at a value of 140 million Jamaican dollars.
The other 8 health facilities include the Albertown, Darleston, and Gale Health Centres, which were rehabilitated at a cost of 146 million Jamaican dollars, and the Cumberland Road, Norman Gardens, Sydenham, Wyndham Road, and the Yallas Health Centres at a total cost of 34 million Jamaican dollars. 3 additional health centres, Mandeville, Port Antonio, and Santa Cruz, will be completed in the coming months. The project aims to create safer, greener health facilities to deliver care after disasters and build climate resilience. The facilities have also been retrofitted to provide better access to persons with disabilities. In the meantime, workers at the St. Anne's Bay Health Centre are praising the initiative and the impact the changes have had on their work environment.
I definitely appreciate the improvements that have been made to the health center. Actually, I've been here since the improvements, but what I've noticed is that the facility looks good. The patients have given their feedback that they like how it is now. There are more offices available, so there is less wasting time as there are more offices for doctors to work from, and the facilities are better in terms of water supply and lighting and ventilation.
I'm grateful to experience such an improved facility due to the improvements that were made by PAHO. With the pandemic going on, it makes it easier to manage these patients in a better environment.
We really are happy that we have the facility. We opened back our doors on November the 29th, and we know that it will do a great level of service for the community. We have a lot of doctors here who are very excited. Persons are going to be coming and having efficient service. So we have a smart facility, and when we say smart, we mean that it is actually safe and it's actually green. We have quite a number of things that have been improved at our facility or clinicians area. We have water storage capacity. We now have a generator, which we're very happy about. And so, if we should lose electricity, the patients will not suffer for it. They will be able to access care in a setting that is still very comfortable. They will not even know that something has gone wrong. And so I just want to thank the British government as well as the Pan American Health Organization for their assistance in making this a reality. So thank you so much.
The same sentiments have been echoed by Minister Tufton, who has indicated that the St. Anne's Bay Health Centre has become a model for other health facilities.
Today on display is a model program. The facility that has benefited here is an indication of a model that we all need to follow right across the length and breadth of the country. A facility that is assessed based on its capacity to withstand threats, natural disaster threats. Because ultimately, no matter what happens from a disaster perspective, a health center and a hospital is supposed to stand strong with the support of its people to respond to those who need those facilities and that type of service. And invariably, if they fall, then clearly the response is going to be that much weaker. And what this smart healthcare facility is intended on doing, and I'm happy to hear about the 70-odd point scoring system outside of the 30 plus that we had, or 27 that we had before. It means we're improving. It means that we are now coming to terms in our system, along with the partners that we have joined forces with, the UK, PAHO, WHO, with the need for us to think about our healthcare infrastructure in a much more holistic term. Linking it to the environment, linking it to the people, and the training and the conditioning of the people, so that we can more effectively respond to the communities, in the first instance to prevent, but also importantly to cure.
Funded by the United Kingdom's Department of International Development Fund, DFID, at a cost of $9.6 billion, the Smart Healthcare Facilities Initiative is being implemented by PAHO in collaboration with health ministries in selected countries across the Caribbean.
That's all for the program today. We hope you learned a little bit more about the Smart Healthcare Facilities in the Caribbean project, and we encourage you to check out the retrofitted facilities that are near you. Remember to send your feedback to jismobe@jis.gov.jm. Until next time, stay safe.